Welcome to Module 9 of the Cancer Toolkit. Please ensure that you've completed all of the previous modules before moving on to this one. Module 9, Living with and Beyond Cancer, supporting people living with a cancer diagnosis. Aims and objectives of this module are so that people understand cancer as a long-term condition, that there's an awareness of different treatment options and possible side effects. There's an understanding of non-clinical concerns of those living with and beyond a cancer diagnosis. There's an awareness of support offers available to those living with and beyond a cancer diagnosis. Awareness of signposting offers those living with and beyond a cancer diagnosis, and to understand how your service could support with non-clinical concerns. It is estimated that 3.5 million people in the UK are living with cancer. Why do we need to know about cancer? Well, people are now living with cancer longer, and the demand for support services closer to home are needed more than ever. You know, it's been estimated that there are currently more than 3.5 million people living with that cancer, and that's rising to 5.3 million by 2040. So based on the latest data, for median cancer survival in the UK, average survival is now estimated to be over 10 years from diagnosis. So if we just look at the little graph, if you like, there, we can see that whilst cancer diagnosis is rising, also survival rates are rising with them. So both national and local feedback indicate that while care is well coordinated and personalised during treatment, the end of treatment can feel very different, leaving people feeling lost and unsure where to seek advice and support. And this has sometimes been likened to the end of a war with a soldier coming off the battlefield and everyone's cheering and happy that the war's ended. But actually, that's when that soldier needs the most support and help, because that's when they've finally come through what might be considered the battle. There are a few main types of cancer treatment that somebody may go through in order to get into remission. It may be surgery, for when it's quite local, chemotherapy, radiotherapy, or they may also try hormone therapy. Or often it's a combination of two or more of these treatments. Now with surgery, there are some possible complications. You have things like wound infection, or there may be bleeding. Some people can suffer from constipation afterwards, depending on the nature of the surgery, depending on what cancer's being removed. Also, people can develop chest infections. There can also be scarring in place that can cause problems as well. With chemotherapy or chemical therapy, it uses cytotoxic drugs to destroy cancer cells. But of course, what also happens there is it's toxic to healthy cells as well. It just happens to kill and destroy the cancer cells quicker. So this is why people can feel so unwell. It can also affect the hair follicles. It's one of the reasons why we see people often losing their hair, because it destroys the hair follicles as it's killing the cancer cells. And it kills cells that are dividing. And normal cells can usually recover, but cancer cells can't. That's what we're hoping occurs with chemotherapy. But this is one of the reasons why people can feel so unwell with it when they go through it. And of course, you may have heard of some of these side effects. Bone marrow can have infection. People can feel fatigue or bruising. The hair follicles, as we've mentioned, can thin and be lost. The digestive system, people can suffer from diarrhea, constipation and nausea. And the mouth lining as well. People say that they develop mouth ulcers and soreness in general. And if you imagine marrying some of these together, it can be a really difficult time. It's a really serious kind of medicine is chemotherapy, and lots of people really struggle to get through that. Radiotherapy, on the other hand, it uses precise, targeted, high energy radiation to destroy cancer cells. People often go along daily for between 1 and maybe 7 weeks. But it can cause damage to nearby cells. It can also cause side effects. It has to be really, really focused in. And people can be locked in so that their head doesn't move if it's in the skull or wherever it might be. And they can feel really quite claustrophobic with that. So some of the side effects we might be looking at there are they may develop during or after treatment, things like tiredness, a real fatigue that can kick in. Appetite can be affected with eating and drinking, and people can feel nauseous, they can feel sick, and also there can be changes to the skin, and they can experience a similar hair loss to that with chemotherapy. Now, sometimes they'll use hormone therapy to treat cancers. These are commonly used to treat breast and prostate cancers. It's also known as endocrine therapy. So hormones may be introduced with a bid to try and reduce and eventually destroy those cancers. But again, some of the side effects you might be looking at. People feel tiredness, and tiredness is often a symptom of cancer, this fatigue that can come about. People also experience muscle or joint aches and pains, symptoms similar to menopause, so people can experience hot flushes, they can have memory issues, and they can also experience a lowered sex drive. Moving on, we've got the social impact of cancer, and as you can see from some of the examples on screen here, there are numerous social impacts that can occur, and people can really struggle afterwards to engage back in what they consider their pre-cancer life, sometimes due to some of the side effects that we're talking about, but also kind of due to a profound change now in how they feel about themselves and where they are after that cancer journey. So there's a real need to have like-minded people who understand the journey that they've been on. And there's language around, because people often talk about battling cancer and fighting cancer, but we know that often people that are living with cancer or have recently been in remission don't like that language, because we don't say that somebody's fighting it, because if they lose that fight, what are we suggesting? They didn't fight hard enough, or they're a battler, they can battle with it. So often people don't like that language around cancer. But the top reported concerns, as you can see there, people have worry, fear and anxiety. They feel tired, exhausted and fatigued. They're in pain. They're uncertain now about their future. They're eating. Their appetite and things can be changed. And all in all, they can often feel quite different from when they first started out on their cancer journey. But there is emotional support involved. And as you can see, there are around 1 in 4 people living with cancer have a high level of psychological care needs. They really need that support in place in order to go on and thrive again in life. And these needs are often poorly met compared to the clinical needs. It can be far more difficult to address somebody's emotional scarring, if you like, than it can for a clinician to say, right, we need to treat this with that, and then this will be the outcome. We know that emotional health's far more nuanced. So you can see there some of the 5 big issues for people in the UK. Things like a lack of support, the fatigue, anxiety and depression, walking, dressing, getting around again, the loss of income. We're living in a cost of living crisis, and the idea that someone's now going to be out of work, that's going to have a knock-on effect for them. This is a little video here that will just show how people can go about accessing support from the local community. It was put together by the West Yorkshire and Harrogate Cancer Alliance.
A cancer diagnosis can be life-changing, but it's important to know you're not alone.
We are here to guide you through how and where to access support when living with cancer. This is known as personalised care.
You may have been offered support to help you prepare for this treatment, such as advice on healthy eating, physical activity and mental well-being. This is known as prehabilitation.
This will continue to support you to manage any side effects you may have, such as tiredness and low mood, to help you to live well. This is known as rehabilitation.
Throughout your treatment, you will have opportunities to have a supportive conversation about what is important to you.
This might include worries about family, friends or carers, not just your physical health, but also your emotional well-being. This is known as a Holistic Needs Assessment, or HNA.
You will then receive a personalised care and support plan. This will tell you where to go to access support closer to home. Within your community, you will be able to access the support you need. This support could include practical, emotional, financial, employment and housing concerns.
It's important to remember that your care continues after your treatment ends. You'll receive an end-of-treatment summary which outlines your ongoing care. This will include signs and symptoms to look out for. This supports the healthcare team at your local GP practice offering a supportive conversation. This is known as a cancer care review.
After treatment, you will be offered a follow-up to monitor your health through regular tests, with rapid access to advice if needed. It's okay to ask for help whenever you need it.
We are here to support you to live well after a cancer diagnosis.
This slide just shows an example of a few of the resources that are out for people that people may find useful. And people often get a lot of help and support from online now. A lot of people live their lives digitally. So there's lots out there. I would encourage us to have a little look here and just check some of these out. Again, these were produced by the West Yorkshire Cancer Alliance. So we know that talking about cancer isn't easy, but we want to help. That's why these modules are put together. And raising the subject with somebody can be such a relief for that somebody instead of shying away from it. So we would encourage you to ask open questions. We would encourage you to use simple, easy to understand language and encourage positive action in people and to actively listen. So often in life we sit there and we're not really truly listening, we're just waiting to talk. We think we know where somebody's going with their conversation and we want to jump in. But when we're helping somebody and supporting them with cancer, we should really listen, try and read between the lines and listen what they're talking about. And normalise talking about cancer, as we know it will affect 1 in 2 of us throughout our lives. So let's not have it talk about in hushed tones or shy away from it. And let's make sure we signpost people to reliable information and not go for those headline-grabbing media outlets. And we also want to know how to respond if someone wants to discuss a symptom and know our boundaries. A little information can be a dangerous thing. So say, oh, you know, that certainly sounds like something you might want to talk about with your GP. Time and time again, we would encourage people to make an appointment with their GP and not say, oh, well, I read online that X, Y, or Z. We know there are lots of cancer forums and nurse helplines out there, as well as there are support services for people struggling with mental health and cancer. And here's just a slide showing some types of community support and the type of support that people might need. You know, there's financial support, there's housing issues, community groups, addiction services. All these things can come together and just help people. There are walking groups, you know, physical support groups, where people can just get out and about when they feel well enough and go on nice walks with other people and feel like they're connecting again with their previous lives after the cancer journey. And here's just an example here. I won't go through all of these, but you can just see on screen of places you can signpost people to, because none of us are experts. It's best to refer somebody in to, you know, an organisation that specialises in providing that support. So if you just have a look there on screen, you'll see a variety of support projects. If we just take a look at this slide, we'll see that there's actually a cancer care map here, which is local to our area, to sort of Leeds and beyond there. And if you look down, you'll be able to see a range of support services that you can tap into and refer people to and signpost them onto, because that's what we need to be doing. We need to feel confident enough to discuss cancer with them, to listen actively and find out what their needs are, and then feel comfortable referring them on so that they can get the support that they need. And here's a range of support groups that can offer emotional peer support to people affected by cancer, which follows on from the previous slide. So please go back and have a look at these and make a note. Don't just keep passing through to get the training past you as quick as you can. These are really quality resources for the local area that will be of some good use to you. And this again, just to really reiterate, some more contacts and some more emails and so on and so forth, and web links that you can use to tap into the support that's out there. And there's also the Regional Maggie's Centre at St James Hospital in Leeds. We also have the Bexley Wing in Leeds, which is the primary cancer unit within West Yorkshire. And there's lots going on. There's also the Robert Ogden Centre in Leeds as well, which people can tap into. This is more a recap really of what we covered in earlier modules about the benefits of exercise with regards for people who are either getting over their cancer diagnosis or trying to avoid developing cancer in the first place. Because we know that it can improve physical health, it can enhance mental well-being, it can be, you know, better treatment outcomes for when people are going through cancer treatments, and a lower risk of cancer reoccurrence in the long term. So it really does help to get active in whatever way works for you. But we know some people affected by cancer will be offered rehabilitation programmes as part of their care in the hospital, and this will help them prepare for treatment. They may be given advice on healthy eating, physical activity and emotional well-being. And this will continue into rehabilitation to support people to manage any side effects they may have, such as tiredness and low mood, to help them to live well. And this is a short video just showing how that can work in real terms for people that are on that cancer journey.
When I was told I had cancer, I literally cried. And that was before I'd even gone in for the further investigations.
There were sleepless nights, fearing the worst, because the diagnosis wasn't specific at that point.
I think the thing that I found the hardest was the emotional and psychological impact of it all.
Active Together is a research-backed exercise treatment programme for people diagnosed with cancer. It was developed by experts at Sheffield Hallam University and is funded by Yorkshire Cancer Research. So when people are diagnosed with cancer at Mid Yorkshire Hospitals Trust, they'll be referred into Active Together.
As soon as I got my diagnosis, I went to see my consultant. She said, we'll refer you to Active Together and we'll give you as much preparation in 2 weeks as we can for your operation. And to be honest, Active Together is just the best thing that ever happened to me.
The physical benefits were getting back on my feet a lot faster than I otherwise would have done. And then the mental and the other side, because it's not just a gym programme. You get a psychologist and you also get a dietitian as well. The psychologist was very helpful, dealing with the outcome of basically facing up to potentially having a fatal illness.
So Active Together is underpinned by scientific research that demonstrates that exercise can improve recovery from treatment, improve tolerance to side effects of treatment, it can increase survival, and it can reduce the chances of cancer coming back.
My surgical colleagues who are dealing with patients after their surgery are really saying that the ones who've been through the Active Together programme, they're doing better and seem to be getting home certainly shorter periods of time. I think it's really good that Yorkshire Cancer Research are putting money into it and funding us so we can prove that this is a benefit to the NHS.
Active Together was vital for me. It was the one place I could go and not feel the odd one out. I could be me. I wasn't any different from anybody else.
This service is so valuable that perhaps maybe the NHS should contribute, or the government in general, because I do think it's a vital cancer programme.
They helped to prepare for what I'd got to go through and to deal with it and to come out the other side. I can't thank Active Together enough.
Here's another example of things that people can do. The Move Against Cancer, the 5K Your Way, which is a support group with a difference in that you walk, jog, run, cheer, volunteer, anything you want, just to help people who are connected with cancer and have been impacted by that. And if you look around, you'll find different cycling and walking hubs all around the area that can help, you know. People are going out, the one-stop shops for people to access the support they need to walk and cycle. And they're just social, good, healthy, social, positive events that people can become involved in. Often people will use them to raise money that can feed into support services for people living with cancer. There's Macmillan Cancer Support, and they can provide things like money advisors, because it's a big worry to people when they get cancer dropped on them, and they may have a treatment package and then feel ill afterwards. People can be on a cancer journey, you know, for a year or more, and they're worried sick about their money. Well, Macmillan provide all manner of support services, including people who can just help them with those money worries, because we do not want additional worries when we're worrying about cancer treatment. You know, we've already got enough on his plate. And trained specialist workers can go through all that with them. So please make use of Macmillan as a cancer support. They are fantastic at what they do. You also may not have heard of the Green Doctor, but it's a groundworks scheme for UK residents which helps them stay warm, stay well and save money on household bills. I'm not going to read through all of this slide because you can see it on screen, but it will just help people with things like if their house is cold and damp. It will help them if they've got respiratory problems. You know, it will help them if they're struggling with their energy bills. So please, again, get people to tap in, especially if they're on low incomes or if they're in receipt of benefits, state benefits. Then making sure they've got a warm, comfortable home to be in should be a priority, especially with British winters. And then this is just another example of a bit of a case study, really, for personalised cancer support with the Staying Well project. So if you have a little read through there, you'll see that Sylvie really benefited from engaging with the whole process. And they went along. She had compromised immunity. She wasn't in a good way. Living alone, all the things that you might worry about when you develop a cancer. You know, she's a pensioner in receipt of housing benefit. And if you have a look, this just sums up some of her situation, her health and well-being impact, her support issues, the housing conditions. There was rat poison present in communal areas. It's not a very nice environment at all. And that was having a big impact, you know. Living on her own, she was experiencing social isolation, loneliness. And this might sound familiar to a lot of people that you support if this is your role. And then if you look, these are some of the things that came out of accessing the Staying Well project. Financial support, practical moving support, Staying Well provided housing support letters, advocating for urgent rehousing, all the things that are just a little overwhelming for somebody. And as support workers, if you are working with somebody who's going through the cancer journey, you don't have to do it all yourself. There are projects out there like the Staying Well project that can do it for you, that can do it with you. This is their day job. This is what they do for a living. And then they would provide ongoing wellbeing support. And if you look there at the overall impact, comprehensive support across housing, practical assistance, financial guidance, social and emotional wellbeing, all the things that somebody needs in one complete care package to make a real positive difference to them. And this just kind of wraps up really with another case study there, which you can have a little look at. I won't go through all of that, but suffice to say, it's another show of how holistic care and support can go on to ensure that somebody can get the care they need and the support prior, during and after that initial cancer diagnosis and treatment. So you just ask yourself really, how could you or your organisation have supported that individual or one that you're working with at the moment? And what approaches or resources might you have just seen in this module that might have helped? Because we would like you to go back and refer to this module often and the information that's there and use it as a working tool, not just something to go through a tick box. There's some great information there that you can tap into. So please use it and go back to it often. And just some key considerations as we're wrapping up, really. Empowering people to access the support's a big deal. People are often nervous. Going anywhere new can leave us nervous. If you're working with people that already experience quite high levels of anxiety or depression, then empowering them and getting them along to engage in the first place can be a really big deal. So please work on that. And, any clinical concerns need to be referred to a medical team. Be careful of knowing your own professional boundaries with that. But please make those connections across those boundaries and try and offer that holistic support. The whole person, the family, the carer, the friends. Keep everybody involved. We really want to avoid isolation during this type of journey, really. This completes Module 9 of the Cancer Toolkit. Please now complete the assessment. Thank you.